watching Let's Chat.
Thanks for staying with us. Here at Let's Chat, we have some important information in this segment. We're going to talk about flu vaccinations. Yes, it's the season, temperatures are getting cooler, and here we go with more vaccines, but flu vaccines.
Yes.
I'm with Sharon Goforth, Special Project Supervisor with the Hamilton County Health Department.
Correct.
Thanks for being here.
You're very welcome. Thanks for the invitation.
Thank you. It's important. So it sounds like something's being rolled out today.
Today is our first official day to offer flu vaccines at the health department, and that includes all of our clinics in the area. So come on down and get your flu shot starting today.
How can people find out where these locations are?
You can go to the website. That gives all our locations, the addresses and the phone numbers, or if you have specific questions, you can always call our hotline at the health department.
Okay, great. Now, why is the flu shot so important?
Well, nobody wants to get sick. And it's one of those kind of simple things that you can do to make sure that during the fall and winter months that you at least give yourself the best chance of not contracting flu.
Do they know which variation they're expecting more of this year?
Well, we always have, they do a quadrivalent vaccine every year, so they have 2 of the A strains and 2 of the B strains, and these are the ones that they think are going to be the most prevalent during the flu season.
I find that so interesting. They study like Australia or wherever their winter's ending.
Absolutely.
And they see what was viral there and then they prepare for here.
That's exactly how they do it. They look at the southern hemisphere and then get their best guess as to what they think will be prevalent here.
And there's been years where they've missed it. It's not common.
Well, once again, we can all get things wrong. So, you know, it's still a best guess as to what's going to happen.
Now, people can get the flu, like even this past summer, if people have been coming down with it. Do you see that a lot?
You can get flu all year round, but we see it most of the time the fall winter months, absolutely.
So how can someone pay for the flu shot? I understand it's not free, which could be a mistaken, reputation.
It's not necessarily free. You may fall into one of the funded programs that we use. We have a Vaccines for Children's Fund. Once again, if you have a child 6 months through 18 years, they may qualify for that. We also have a federally funded vaccine program that gets in our adults are 19 through 64. So if you qualify for those, it may be free or it may be a discounted price.
Now, you might hear people nervous about vaccines. People are nervous about the COVID vaccine. Do you see that with the flu shot, and why would you encourage people to not be afraid?
Well, a lot of people, it's really just the injection, the whole injection thing. It's not necessarily a specific vaccine. But for most people, it's really a very simple thing. You're going to have a little bit of a sore arm. Most people don't have much more than that. But I think for a lot of people, it's just they just don't like shots. And we understand that.
Sure. Now, what's the youngest someone can get a flu shot?
6 months.
6 months.
We don't vaccinate less than 6 months.
Right. Now, are they still doing the nose mist?
We are still doing some of what we call the flu mist.
Okay.
So we will have some of that at the health department, but that does fall into our VFC, or our Vaccines for Children. So at the health department, we will only be able to do the flu mist for 6 months through 18 years. So if you're an adult and you want that, you might want to talk with your primary care or with any of the local pharmacies.
Speaking of people worrying, what other boosters, vaccines, other shots can people get along with the flu shot?
You can get anything along with the flu shot, and obviously this year we're recommending flu and COVID together. If you're going to be there, let's do both of those together, which you can do safely. But we also understand some people want to do those separately, and that's okay too.
Now, how does it feel to work for the health department and to keep the city safe and healthy?
We enjoy it a lot. Once again, our whole idea is to try to make you as healthy, or to keep you as healthy as we possibly can. And once again, I don't know anybody who likes to be sick. So come on down and let us do this.
That's right. Are there any predictions to how bad the flu season will be this year? Do they ever say that?
Sometimes they do, but I think it's too early on to kind of do those predictions yet. As we get further in, we'll start to see some trends and some data that may indicate something to us. But right now, not really. They're just encouraging everybody to come and get one.
Okay, great. So today they're being rolled out.
They are.
The locations can be found on the website.
Yes.
And it sounds like a very important thing to do to stay healthy as the temperatures drop.
It is.
Well, thank you for being here, Sharon.
You're very welcome.